Have you ever felt a strange tingling or irritation on your skin that keeps coming back, no matter what you do? Many people brush it off, thinking it's just dryness, a bug bite, or maybe even a reaction to soap. But sometimes your body is trying to get your attention in ways you might not expect. Persistent itching in certain areas can actually be an early warning sign of deeper health problems, especially as we get older. What feels like a simple nuisance could be your body's way of flagging an issue that deserves a closer look. In today's video, we're revealing 5 specific areas where recurring itchiness might point to hidden health concerns after age 60. These aren't random spots, they're areas linked to your liver, kidneys, or even your immune system. And ignoring these subtle clues could mean missing an opportunity to catch a serious condition early. Make sure you watch until the very end, because the final itchy area we'll talk about is one most people overlook. And it may be the most important signal your body is sending you. You won't want to miss this, especially if you or a loved one are over 60. Number 1, itchy scalp that won't go away. Let's start with one of the most overlooked areas, your scalp. Many people over 60 assume that an itchy scalp is nothing more than dandruff, dry skin, or the result of a new shampoo. And yes, sometimes it's exactly that. But when the itching becomes persistent almost daily and doesn't improve with moisturizers or medicated shampoos, it might be something far more concerning. An itchy scalp that lingers could be an early sign of an underlying condition that's quietly developing beneath the surface. One of the possible causes is a condition called seborrheic dermatitis, which is linked to inflammation and immune system changes. But beyond that, constant scalp itching has also been associated with liver problems. When the liver struggles to filter toxins from your body effectively, those toxins can build up in the bloodstream and cause your skin, particularly on your scalp, to become irritated and itchy. It's your body's way of saying, hey, something isn't right. Another serious cause of persistent scalp itching is kidney dysfunction. The kidneys play a crucial role in filtering waste from your body. If they aren't working properly, the buildup of waste in your blood can trigger itching in unexpected places, including your scalp. This is often overlooked because most people don't connect scalp itchiness to kidney health. But several studies have shown a clear link between chronic kidney disease and unexplained itching sensations. Additionally, certain types of cancers, like lymphoma and leukemia, can also present early symptoms through skin changes. Many patients report persistent itching, particularly on the scalp and upper body, long before any other symptoms appear. It's your immune system reacting to the abnormal cells in your body, sending you signals through your skin. For women over 60, hormonal changes may also play a role. As estrogen levels decline, skin becomes thinner and more sensitive, making the scalp prone to dryness and itching. However, when the itch feels intense, persistent, and accompanied by other symptoms like fatigue, weight loss, or swelling, it's crucial not to dismiss it. Here's the thing, your scalp is one of the easiest areas to ignore because it's hidden beneath your hair. You may scratch without thinking or assume it's no big deal. But if the itching won't go away, lasts more than 2 weeks, or gets worse over time, it's worth discussing with your doctor. A simple blood test or skin exam could reveal a much bigger picture about what's happening inside your body. By paying attention to these small, persistent signs like an itchy scalp, you may catch potential health issues early, before they turn into something more serious. Sometimes your body whispers before it screams. Listen to the whispers. Number 2, persistent itching on the lower legs. Now, let's talk about another spot many people ignore, your lower legs. Occasional itching on your legs might seem harmless. Maybe you assume it's dry skin, aging skin, or irritation from shaving or tight clothing. But when that itch becomes persistent, happens daily, or seems to flare up at night, it could be much more than a minor skin issue. As we age, circulation becomes one of the most important health factors to monitor. Poor circulation, also known as peripheral artery disease, PAD, is one of the most common yet silent conditions affecting people over 60. And guess what? Chronic itching in the lower legs is an early warning sign of PAD. When arteries become narrowed or blocked, your legs don't receive enough oxygen-rich blood. This can cause the skin to become dry, irritated, and prone to itching. Most people don't connect that annoying itch with their heart and arteries, but it's one of your body's early alerts. Another possible cause is diabetes-related nerve damage, known as diabetic neuropathy. High blood sugar over time can damage nerves, especially in the legs and feet. One of the earliest symptoms is unexplained itching, burning, or tingling sensations in the lower legs. Many seniors with diabetes or pre-diabetes dismiss this discomfort as dry skin, but it's actually your nerves crying out for help. Liver disease can also show up in this area. When the liver struggles, bile salts can accumulate under the skin, triggering intense itching, particularly on the legs and arms. Some patients with liver problems report that the itching worsens at night, disrupting their sleep and quality of life. If you experience persistent itching on your lower legs combined with yellowing of the skin or eyes, fatigue, or swelling, it's time to talk to your doctor. One more hidden cause that's often missed is a condition called venous insufficiency. This happens when the valves in the veins of your legs don't work properly, making it difficult for blood to flow back to your heart. As a result, blood pools in the lower legs, leading to swelling, skin changes, and, you guessed it, chronic itching. This condition increases with age and can easily be overlooked if you only focus on the itch without looking deeper. It's easy to assume that leg itchiness is just part of getting older, but your body is far too intelligent to make noise without reason. If your lower legs itch consistently, or you notice changes in skin color, swelling, or visible veins, don't ignore it. These may be early signs of something that can be treated if caught early. Your body has no reason to keep itching the same spot unless it's trying to tell you something. Listening to these signs could save you from much bigger health problems down the road. Number 3. Itchy palms and soles of the feet. Next, let's focus on an itchy spot that many people never think twice about: the palms of your hands and the soles of your feet. Most people assume that if their hands or feet are itching, it's just dry skin, sweat, or something they touched. But when that itching becomes persistent, especially without any visible rash, it could be a sign that something much deeper is happening inside your body. One of the most concerning causes of itchy palms and soles is related to liver health. A condition called cholestasis can develop when the normal flow of bile from the liver slows down or becomes blocked. This leads to a buildup of bile acids in the bloodstream, which can cause intense itching, particularly on the hands and feet. What's tricky is that many people will feel perfectly healthy otherwise and dismiss the itching as nothing serious. But cholestasis is often linked to underlying liver diseases, such as cirrhosis or non-alcoholic fatty liver disease, which become more common after age 60. Another potential cause of persistent itching in these areas is related to diabetes and pre-diabetes. When blood sugar levels remain high over time, it can damage small blood vessels and nerves, particularly in the extremities. This can lead to itching, burning, or tingling sensations in the hands and feet, often before a person even realizes they have blood sugar issues. If you're experiencing itching along with increased thirst, blurry vision, or fatigue, it's worth checking your blood sugar levels. Thyroid disorders are another hidden culprit. An underactive thyroid, hypothyroidism, can cause the skin to become dry, rough, and irritated, especially on the hands and feet. This is because your thyroid controls your body's metabolism, which affects how your skin retains moisture and heals itself. For people over 60, thyroid conditions often go undiagnosed because the symptoms can be subtle at first, like fatigue, weight gain, and yes, unexplained itching. There's also a rare but serious condition called primary biliary cholangitis, PBC, an autoimmune disease that slowly destroys the bile ducts in your liver. One of the earliest and most specific symptoms of PBC is chronic itching of the palms and soles, often worsening at night. If left untreated, it can lead to liver failure. Lastly, medications and allergies can also trigger itching in these areas. But if you haven't changed any products or medications recently and the itching keeps returning, it's time to look deeper. Your hands and feet are loaded with nerve endings, making them extra sensitive to internal imbalances. When these areas itch without an obvious external cause, it's often your body trying to alert you to something more serious happening beneath the surface. Don't ignore it. When your palms and soles won't stop itching, it may be time to check what's going on inside. Number 4. Itchy back, especially between the shoulder blades. Now, let's talk about an area most people never associate with health problems: the upper back, particularly between the shoulder blades. An occasional itch on your back is nothing unusual. It could simply be dry skin, a little sweat, or irritation from clothing. But when that itch becomes persistent, happens daily, or even wakes you up at night, your body might be warning you about something much more serious. One of the most common yet under-recognized causes of chronic itching on the back is related to your nervous system. Specifically, a condition called brachioradial pruritus often appears as intense itching on the upper back and arms. It's linked to nerve compression in the cervical spine, meaning your neck vertebrae might be pressing on the nerves that control sensation in your upper back. This nerve irritation can develop from years of posture changes, arthritis, or degenerative disc disease, which are all common after age 60. Most people think it's just a skin problem, but the real issue is happening deep in the spine. Another cause of upper back itching is related to liver and gallbladder issues. When bile production is disrupted, as in the case of liver disease or gallstones, one of the first symptoms people report is itchiness on the back and shoulders. This is because bile salts can build up in your bloodstream and deposit under the skin, triggering that maddening, persistent itch. Kidney dysfunction is another hidden culprit. When your kidneys can't properly filter waste from the body, toxins accumulate in the blood, leading to itching, particularly in larger areas like the back. For many people, this is one of the earliest signs of declining kidney function, long before more obvious symptoms like swelling or fatigue appear. Shingles caused by the reactivation of the chickenpox virus often begins with an itchy or tingling sensation on one side of the back, sometimes days before the painful rash develops. People over 60 are at a higher risk for shingles, and that phantom itch between the shoulder blades may be the first red flag. Lastly, your back may also itch due to internal cancers, particularly lymphoma or pancreatic cancer. It's not common, but several studies have noted that unexplained persistent itching, often on the back, can be an early symptom. Your immune system recognizes something abnormal, and the skin reacts, even when there's no visible rash. The reason this itchy spot is so often ignored is simple. You can't easily see or reach it. But that doesn't mean the signal isn't important. If you've noticed that itch sticking around for weeks, getting worse at night, or spreading without explanation, it's time to investigate. Your body is always speaking to you, sometimes in whispers, sometimes through an itch on your back that refuses to go away. Don't ignore it. It could be the earliest warning sign your health is shifting. Number 5, itchy scalp that doesn't go away. Finally, let's talk about one of the most overlooked and commonly dismissed itchy spots, the scalp. Almost everyone experiences an itchy head at some point. You might think it's just dandruff, dry weather, or a shampoo reaction. But if you're over 60 and your scalp itching becomes persistent, without clear reason or relief, it may be a signal of something far more serious. 1. Underlying cause of chronic scalp itching is autoimmune disorders, particularly scalp psoriasis or seborrheic dermatitis. These conditions trigger inflammation in your body, and your immune system starts attacking healthy skin cells. But beyond the surface irritation, an overactive immune system can point to larger internal imbalances, sometimes related to metabolic disorders, arthritis, or even increased cardiovascular risk. Another cause worth paying attention to is iron deficiency anemia. Many seniors don't realize that low iron levels can make the skin, including the scalp, hypersensitive and itchy. If your scalp itching is accompanied by fatigue, weakness, or hair thinning, it might be your body's way of telling you that your blood health is off balance. But one of the most serious and easily overlooked causes of scalp itching is related to kidney disease. When kidney function declines, waste products build up in your bloodstream, leading to a condition called uremic pruritus. This itching is often felt on the scalp, face, and arms, and no amount of scratching seems to relieve it. Many people ignore this sign because it starts subtly, but over time it can become severe and affect your sleep, mood, and overall quality of life. Thyroid. Problems can also show up on the scalp. An underactive thyroid, hypothyroidism, slows down your body's processes, leading to dry skin, brittle hair, and yes, chronic scalp itchiness. Many seniors live with undiagnosed thyroid issues, simply thinking it's part of aging, but that constant itch could be your clue to get your thyroid checked. Finally, there's one more hidden reason your scalp may be itching: stress and anxiety. After 60, many people experience increased stress due to health worries, family responsibilities, or major life changes. What most people don't know is that stress can trigger histamine release in your body, leading to unexplained itching, especially on sensitive areas like the scalp. This type of itching doesn't respond well to creams because it's coming from the inside out. The reason scalp itching is so often dismissed is because it's so common. But when it becomes constant, disrupts your daily life, or doesn't improve, with normal treatments, it's time to ask what your body is really trying to tell you. An itchy scalp could be the earliest red flag of an underlying condition that's quietly developing in the background. Listening to these subtle signs could help you catch serious health issues early, before they become life-altering. Thank you so much for watching. If you found this video helpful or eye-opening, don't forget to hit the like button and subscribe to this channel for more important health tips and information. Your support helps us continue creating content that could make a real difference in your life. Also, turn on the notification bell so you never miss a new video. Stay informed, stay healthy, and I'll see you in the next one.